The difficulty is to measure it. So there's no standard medical imaging test that can really tell you how much a patient will feel their pain.
McGill University researchers in Montreal are explaining why chronic pain is generally discounted. Their new study shows that it can be better assessed when doctors take a holistic approach.
The problem here is that there's no one-to-one relationship between the manifestations of the disease or the injury, the physical damage to the body, and the pain itself.
Study lead Etienne Vachon-Prassot says they were able to create a clear picture of chronic pain by combining biological data or biomarkers, which can help predict and monitor various conditions while using machine learning.
While we can predict different medical conditions, such as rheumatoid arthritis or gout, the algorithm had a hard time to predict the subjective experience of pain.
He says they hope to enhance programs that cater towards chronic pain and addressing social factors.
This tells us that we can have some hint about who we should invest with different programs, such as psychological support, for instance, stress reductions, improved sleep quality. There's some intervention targets that we can derive from that. How this can improve pain management in clinics. For instance, here at McGill, we have a tertiary pain clinics, and they have already this multi-dimensional approach. They also have psychological support, for instance. They can have interventions on nutrition, they can have for sleep hygiene, they can have a lot of different interventions that can ultimately help the patient beyond just focusing on the physical injury.
He says the most common injury that many experience is lower back pain.
There's a lot of different things that can cause back pain, so it's really hard to find a single biological marker for back pain because it really depends on the etiology or the nature of the conditions. It's a worldwide problem. It has a huge societal burden over the individuals, but in terms of cost, economy, in terms of health resources, it's something that really needs to be addressed. And I think people underestimate how much pain impact the people in the society.
He adds that patients, healthcare providers, and policymakers will benefit by adopting these approaches to assess chronic pain.
At least raise awareness that this is like a real condition that impact a lot of people, and we need to be aware of it to better understand it, and then hopefully have better approach to treatment to manage it.
In Montreal, Dahosteri Hastir, City News.